Scoliosis. Scoliosis. A medical condition in which a person has a sideways curvature of the spine. It is often present itself, or worsens, during an adolescent's growth spurt. People who have reached skeletal maturity are less likely to have a worsening case. Types. Sorted by location: thoracic scoliosis, around thoracic. C-shaped curve. Lumbar scoliosis, around lumbar. C-shaped curve. Thoracolumbar scoliosis, between thoracic and lumbar. C-shaped curve. Combined scoliosis, both thoracic and lumbar. S-shaped curve. Types. Sorted by direction of curve: levoscoliosis, left. Dextroscoliosis, right. Comparison. Scoliosis, curvature on coronal plane. Kyphosis, curvature backward in thoracic spine on sagittal plane. Lordosis, curvature forward in lumbar spine on sagittal plane. Sway back. Pelvis is positioned in front of the body's vertical midline. Forward head. Head is positioned with the ears in front of the body's vertical midline. Flat back syndrome. Reduced or eliminated curvature in lumbar spine on sagittal plane. Symptoms. Shoulders. Uneven. One scapula appears more prominent than the other. Waist. Uneven. One hip higher than the other. One side of the rib cage jutting forward. Spine. Prominence on one side of the back when bending forward. Short stature. Organs. In severe cases, it can reduce the lung volume, making it difficult for the lungs to function properly. In congenital cases, various heart, kidney, and abdominal anomalies can be seen. Causes. Idiopathic. Unknown causes, majority. Congenital. Some patients have bony abnormality within the vertebrae, which can lead to abnormal curvature. These curves are usually acute and progress rapidly. Syndromic. Various systemic diseases have associate spine deformity, e.g., Marfan syndrome, Down's syndrome, osteogenesis imperfecta, neurofibromatosis, neuromuscular loss of muscle support to spine due to inherent problems in muscles or lack of muscle coordination from brain or nerve. Secondary. Uneven destruction of bone by spine infection, spine fracture, or spinal tumors, e.g. osteoid osteoma. Degenerative. De novo, adult patients may have unequal degeneration of vertebral segment, unequal leg length with pelvic obliquity, muscle spasm, slip disc, and rarely psychosomatic issues. Risk factors. Females are affected more than males. Secondary scoliosis. Due to neuropathic and myopathic conditions, it can lead to a loss of muscular support for the spinal column so that the spinal column is pulled in abnormal directions. Muscular dystrophy, spinal muscular atrophy, poliomyelitis, cerebral palsy, spinal cord trauma, myotonia. Degenerative scoliosis. Diagnosis. X-rays, MRI, CT scan. To see if the curve is getting worse. Electromyography and nerve conduction velocity, EMG, NCV, testing. Testing for neck and spine conditions as well as neuropathies, carpal tunnel syndrome, and sciatica. Treatment. Not necessary, in many cases. Brace, cast. Stops the curve from worsening. Surgery. Straightens severe curves.